we had a discussion about Ahmaud Arbery recently, and what does it mean to run in a neighborhood safely in a predominantly white community?
Yeah.
And I would compare that to a lynching. Similar to what the coronavirus is doing in our society, it is not respecting the boundaries that we put between ourselves. So it doesn't respect race, religion, your walk of life, where you live, how you live. Similarly, in order to combat the inequities that we're seeing that is exposing, we have to break down the barriers that exist between us, whether perceived or not. And though the practice of active racism, so things like night rides and Ku Klux Klan, Unite the Right rallies, we clearly marginalize those parts of society. What these entities have left behind is racism codified in a more subtle context, a more institutionalized context.
As the COVID-19 pandemic continues, it's become clear that people of color have a higher risk of developing serious illnesses and dying than other populations in the United States. African Americans, who already suffer from a historic healthcare disparity, are at a greater risk than any other racial group in the country. Here to talk with us today about this health disparity and possible solutions is Dr. Taison Bell, an assistant professor of medicine in infectious disease and international health and pulmonary and critical care medicine at UVA. In addition to his academic roles, Dr. Bell works to improve equitable healthcare in the community. Dr. Bell, welcome to the show.
Thanks, Nico. It's nice to be here and happy to talk about this very important topic.
Well, let's just kind of jump right in then. So preliminary studies have found that African Americans suffer a much higher risk due to COVID-19 than perhaps anyone else. In a recent article released in the last few weeks by the New York Times Magazine, journalists found in multiple states that while African Americans make up a minority of the population, they compose a majority of the deaths from COVID-19. For example, in New York City, African Americans with COVID-19 are twice as likely to die as their white counterparts. And in Chicago, African Americans make up 30% of the population, but represent 56% of the deaths related to COVID-19. One additional statistic that came out more recently from the Census Bureau was that African Americans make up about 13% of the US population, but 27% of known COVID-19 deaths. Would you be able to comment on sort of this overrepresentation of African American communities during the COVID-19 crisis?
Sure. Well, as you point to earlier, this is a complex problem, obviously, but it's related to a lot of structural inequity that have led to a difference in health outcomes. So the wealth gap, unemployment, discrimination, these are all things that feed into health outcomes. We know that Black communities suffer higher rates of chronic conditions, for example, obesity, diabetes, hypertension, congestive heart failure. In addition, Black communities are more likely to be employed as essential workers who cannot work from home. So they're at increased risk of contracting the disease because they're not able to shelter in place as frequently as whites. I saw one statistic that showed that 20% of African Americans have the ability to work from home versus 30% of their white counterparts. Also, Black communities are more likely to be densely populated, multi-generational housing. We can get into the historical practices behind that. And finally, even if there is access and the ability to tap into healthcare, Black communities suffer less quality of care. So even if there is good testing and treatment that are available, it is generally less available to Black communities.
So what I'm hearing you say here is that a lot of the problems underlying the reason for this disparity in the African American community during COVID-19 aren't necessarily new issues.
Right. I would say that these were all issues that existed beforehand. It just didn't have a spotlight in the general conversation around healthcare, at least not in the way that it needed to be at the forefront. So it's kind of like you're walking along and you see a couple of bugs on the street, and you have a certain reaction to it. But if you flip over a rock, then you see a lot. You have a very grotesque reaction to it because it's really startling. I think that COVID has exposed a lot of that gaps that people who've studied this or lived the experience have known about. But we've been accustomed to seeing these disparities. Now that we have this acute crisis where thousands of people are dying in these communities,
Yeah.
and hundreds of thousands worldwide, millions actually. Now that we've exposed to the general public what's going on in African American community, we've seen that these historical trends now manifest in a really severe way.
And a couple of things come to my mind when I hear that. Number one, how sad is that this community is suffering from such a terrible disease. At the same time, is there a possibility that the attention brought to an issue like this might open the opportunity for some change?
Well, there is a quote from Winston Churchill that you shouldn't let a crisis go to waste. And I think this is a good opportunity to first expose what these problems are, hold our elected officials accountable, and find a way to actually forge together, find creative solutions to the problem. I think one of the main problems in healthcare is that we're not incentivized to provide quality care over doing procedures in privately insured patients. And we have a lack of a good safety net as well too. In addition, we don't treat essential workers very well. We're highlighting some of the work that they do now that they're showing up on the front lines. But when life was normal pre-COVID, and I'm fearful of post-COVID, we'll be back at low wages, less benefits, no paid sick leave, and putting additional economic stress on a segment of the community that really drives the country forward.
So what I'm hearing you say is if we don't do something now directly to address this, we might end up in a even more dire situation for these communities.
Right. If we fix this problem, it's a win-win for everyone. If we can decrease health disparities, people can live longer, healthier lives and be less costly to us ultimately. We can increase economic productivity. We can tap into the full potential that Black and brown communities have to offer if you work hard at reversing historical and ongoing discrimination.
And tell me, talking about historical discrimination and the context of kind of these disparities that have been brought to light by the COVID-19 pandemic. Can you tell me a little bit more about what are some of those forces in play that we're now kind of seeing kind of the result rear its ugly head a little bit?
Yeah, that's a really good question because it's not fair to talk about health disparities without talking about the underlying context underlying them. So let's take a few examples, for instance. We talked earlier about how Black and brown communities will tend to be in more densely populated regions that are in multi-generational housing. This dates back to redlining practices where banks that were offering Americans what was called the American Dream house ownership, which is usually the largest purchase that a household can make. And it's been a vehicle for generating wealth over time as home values appreciate. We hear many stories about people tapping into their home equity to start businesses, to go to college, to give loans to themselves through hard times. But because of redlining, African Americans historically were limited to living in certain areas. And then when they were given loans, they were non-favorable terms. So you were living in an area that you were forced to live into because you weren't able to live in a white, wealthier community. And then the loan that you had was more costly to you than your white counterparts for the same amount of value. So over time, the power of inflation erodes the wealth that you have in your home, and you no longer have access to that wealth so that you can realize your full potential. So if you have a creative idea, if you want to start a business, if you want to be able to send your children to school, you no longer have that collateral that you can offer because that wealth has eroded. In addition, wage and employment disparities have decreased the economic potential of the community as well too, and that forces people to combine resources and live in multi-generational housing. I saw one statistic where if you had a name that was traditionally Black and your name was on a resume, you were less likely to be interviewed by a white counterpart who had a jail record. So even if you had a clean record, you were less likely to get a call back than a white counterpart who had a prison record.
Wow.
It's that ingrained in unconscious bias in hiring and employment discrimination, education discrimination as well. Pell Grants have been a traditional vehicle of means for low-income communities to access higher education. I actually received the Pell Grant when I came to UVA, and that was one of the reasons I was able to afford it. Pell Grants have been cut now. They're discretionary spending in our federal budget, so they're always on the table, and they've been under threat. Opportunity is, as far as realizing your potential, can be suppressed by over-policing and disproportionately harsh prison sentences. So even though as human beings, as a society, a lot of people engage in crime and things like drug offenses and minor violations, but historically and ongoing, Black communities suffer more aggressive sentencing, more aggressive arrests. And it's hard to talk about diabetes and hypertension without talking about underlying disparities in access to fresh fruits and vegetables. So food deserts are areas where you're not able to get to a grocery store that offers high quality food at a low cost. A lot of communities with Black and Brown residents do not have access to grocery stores where you can access healthy food. So what's available, bodegas, corner stores, things that have high processed foods, high salt, high sugar content over fresh fruits and vegetables. So all these things have, whether designed to deprive one community at the expense of another, or whether it's unconscious bias that's ongoing, these are structural reasons that have led to inequality, that have led to worse health outcomes. The most important thing is to call it out as racism. It's structural racism that's either codified or ongoing and institutionalized. That is suppressed the potential of the African American community and is translated to adverse health outcomes.
Wow. It's apparent that there's a lot of complex issues behind the COVID-19 pandemic, things that go back generations in their origins. And now we're kind of seeing the results of that. I kind of wanted to respond with a quote from Dr. Williams at the Harvard School of Medicine, who kind of gives us a reminder about remembering that these statistics about African Americans being overrepresented by deaths from COVID-19 not necessarily being linked to any of the decisions that Black people have made. So he says, it's important to recognize and to acknowledge that the higher death rates of African Americans from the coronavirus are not linked to the individual decisions Black people have made or their communities have made. We're looking at societal policies driven by institutional racism that are producing the results that they were intended to produce.
I think the key part of that quote there is intended to produce, because what we are left with now is a system that was inherited from a time when it was acceptable to codify racism into your institutions. And though the practice of active racism, so things like night rides, the Ku Klux Klan, Unite the Right rallies, we clearly marginalize those parts of society. What these entities that left behind is racism codified in a
Mm.
more subtle context, a more institutionalized context. So, um, and I think this becomes a talking point that is really malinformed whenever a issue that is plaguing the Black community comes up.
Mm.
The tendency is to blame Black people for their own problems. So, as an example, in the 1990s when we were talking about crime and in imposing harsh sentences on crack cocaine use, and that was disproportionately affecting the Black community. And we had a very harsh approach to aggressively um, locking up drug abusers, putting them in harsh sentences, and that was seen as a solution because it was seen as a personal deficiency and not deficiency of how we treat drug addiction. I think now that we're seeing an opiate crisis now that is affecting a lot of white Americans, we have a
Hmm.
much different approach to that. We're saying we need to emphasize
Right.
treatment, recovery. This is a disease; it's not a crime.
Hmm.
And what sort of potential could we have had if we'd had that approach to the crack epidemic in the 80s and 90s? So unconscious bias and even overt bias, these are ways that decisions that institutions and others make can have an adverse impact, but it may not be as in your face as what we've studied in the history books. We can have this tendency to say we've moved beyond that. We don't have instances where we have lynchings or anything like that. I put forward the argument that we had a discussion about Ahmaud Arbery recently, and what does it mean to run in a neighborhood safely in a predominantly white community,
Yeah.
and I would compare that to a lynching, vigilante justice, and seeing someone who looks different, who you perceive as a threat, and connect that with a crime that you perceive is going on in the community that was never reported, and then you have the sense that you can impose your own justice on this person who's running down the street trying to exercise without retribution. That is a leftover from yesteryear that's manifest today. The ability to think that you can impose justice and assault and kill a Black body and not be punished for it, that is where this manifests.
Yeah. Wow, Dr. Bell, that's a powerful image that you've left kind of in our listeners' minds. Um, you know, might not be the same method, but drawing the relationship between a lynching definitely leaves a horrifying image, um, and makes us think. Maybe some of these underlying problems are still really there, just a little bit less visible on the right under the surface.
I agree. It's very powerful wording to say things like racism and lynching, but
Hmm.
it's also important to recognize what's actually happening.
Yeah.
The perspective of a Black male. I have a son as well, and I have to think about how to navigate him through the world. And we have to talk about all these issues. And to think that I'm 9 times more likely to be pulled over by the police, and more likely to have violence inflicted on me because of my skin color. And that plays out on very frequently on the decisions that I make and the choices that I make and how I navigate my
Hmm.
spaces. And even though I don't talk about it frequently, it doesn't. I'm used to it, so it doesn't weigh on me as I go about through my day. It's just things that I've done to increase my own degree of safety. But to be able to talk about these issues is also very important because similar to what the coronavirus is doing in our society, it is not respecting the boundaries that we put between ourselves. So it doesn't respect race, religion, your walk of life, where you live, how you live, certainly not geography. Similarly, in order to combat the inequities that we're seeing that is exposing, we have to break down the barriers that exist between us, whether perceived or not.
Hmm.
And one of those ways is just understanding the struggle that other communities are going through and getting a full understanding of what you're seeing at the surface, but also what lies underneath, what is and often even more rich with context and information, and gives you a sense of the root cause that you have to really work at reversing.
Well, that's kind of a great segue into kind of some of the next question I was really going to ask you, which is like, well, this seems like a really complex and really big problem to tackle right now. But what can we do about this? Is there anything being done to address this right now? Or what sort of solutions beyond what you just stated do you see that we can sort of propose right now?
Sure. So, I think we have two phases of this, right? We have the immediate crisis going on right now that we have to address because coronavirus is still circulating throughout the world and people are dying from it.
Yeah.
So increasing access to testing, understanding where your deficiencies are in testing, getting point prevalence in high risk communities, that's absolutely essential. And the talk from the White House that testing may be overrated is completely absurd speak. So we don't even have to go there because I could divert the rest of the podcast to talking about how ill-advised that is. But
Yeah.
testing is very important. Getting access to care is very important. We have to recognize that a lot of care in Black and Brown communities are done by academic medical centers and facilities that are under even more financial stress than the typical hospital. So, when you look in New York City, you look at hospitals, certain hospitals in Brooklyn versus hospitals in Manhattan, there's a disparity there between wealth and access to resources. And the hospitals that are serving underserved communities will typically have less access to resources and PPE in their workforce, which will also tend to be more Black and Brown. We have to think about an equity lens, similar to the glasses I have on my face, to be thinking about, how do the decisions that we make and what's playing out affect our vulnerable communities, Black and Brown communities in particular. So from the beginning, if we were talking about how coronavirus is going to impact our country, it would have been very helpful for the CDC and other health agencies to be thinking, we've seen historical inequality and inequities in Black and Brown communities. Are we seeing that with coronavirus, and how do we proactively fight against that? Rather than a call that comes from Black and Brown physicians to demand the CDC and other health entities to release their information. And now, weeks into the crisis, we're now seeing that we have adverse outcomes in the Black and Brown communities. We need to have a much more proactive approach when it comes to our policymaking and how we distribute care. I think another important point, this is more for the longer term, is how do we structure our healthcare system so that we have a robust safety net and that we're incentivizing hospitals and health systems to provide high quality care versus high margin care. So as a health system, and we're seeing this play out now because we've halted things like elective procedures and ambulatory visits, a lot of the hospital's margins are driven by doing things like orthopedic procedures, catheterizations on privately insured patients. And in some instances, your margin could be 6 times as high with a private insured patient than it can be for someone who's on Medicare or Medicaid. So as a hospital system, if you want to be financially sustainable, you are going to want to focus on these high margin patients. And that's at the expense of people who are publicly insured or uninsured. So we have to change our incentives so that a hospital feels just as financially sound about treating a low income patient or a patient who's uninsured and have a mechanism to reimburse that, whether it comes from a private or government solution, as it would pre-COVID, where we wanted to focus on high value, high margin procedures. So that's certainly one. And then we absolutely have to address the wealth gap that exists in the country. We talked about the service sector and how there are not a lot of protections for people who are doing essential labor. Wages are low. A lot of people who work full-time jobs in this country still are on government support in the form of food stamps, TANF, and other supplemental payments. And that really shouldn't be the case in our country. Another thing to address is how we've linked healthcare to employment in this country. And obviously that's going to be a problem when we have things like recessions and depressions that are going to happen in the course of a normal economic cycle and lifespan of a country. This is something that emerged out of the Great Depression as a way for entities or companies to offer reimbursement to employees in another form, even though they didn't have cash reserves to offer more wages. But now that we've seen how insurance can be unlinked so easily when people become unemployed, We see how much of a problem that is. And a lot of these low-wage essential work jobs are also do not come with benefits like healthcare. Whether we want to make this a political argument or not, we have to recognize that the country pays the price regardless for non-reimbursed care, and it would be better to have a mechanism to incentivize hospitals to provide that care and make it so that they can have healthy balance sheets and sustain and invest in technologies in our labor force, but also provide high quality healthcare to underserved communities.
Right. So kind of what I'm taking away from this is that, we're going to be paying for this care, one way or another. And we can pay a lot of money if it's in an unstructured system where patients, come in, they're uninsured or underinsured. Or we can have a more centralized system that's more organized in incentivizing high value care. And ultimately, it might cost actually less money.
Yeah, in the end, I believe it would cost us less if we were able to actually keep people healthy rather than provide sick care.
Mm. Well, those are some big talking points that you've given us so far, sort of on the national level. How about for sort of the listeners to this podcast in Virginia or in Charlottesville around UVA? Are there some things that you think some of the local individuals in the local community might be able to do right now? For example, healthcare professionals, community organizers, or just the listeners?
Sure. I think it's important to recognize that we all have the ability to contribute to the cause, whether it's your skill, your money, your talents. Obviously, healthcare workers have a role to play in delivering healthcare. I think the other thing to recognize is that we do have a voice that we can use. A lot of times we feel powerless to reverse the course of what's happening, and you can kind of, see yourself in the context of this large healthcare system with many problems that are linked to things outside of healthcare, like access to healthy food. And you could think, how can I actually make a difference here? But you can. I've had friends that I've linked with who have many different talents that they have to offer: engineers, sewers, people who do data modeling, all helping out in the coronavirus crisis to do things like produce PPE to make sure that we're able to match our staffing with our projected COVID surges, provide food in the community. Dr. Hilton, Dr. Webb made a flyer that distributed through the community about safe practices around COVID care and answering commonly asked questions. We have the ability to help. We just have to believe that we have the ability to affect change. Change isn't often this large, magical, romantic shift. It's often making slow progress day by day, and realizing that at the end, and that's an important message to get across. That even if you feel like you are sitting at home doing a bunch of Zoom meetings and not engaging that much, that there is something that you can do.
Yeah, and sort of a follow-up question to that, like what specifically do you think like some of these individuals might do to address not only the coronavirus crisis as it stands right now, but some of those disparities that we're seeing borne out by the crisis?
So we've seen how the coronavirus, it only requires you to be a human being, and does not respect any of the barriers that we erect between us. We have to respond in kind as well, and realize that our society is set up to value certain individuals over others, certain communities over others, and we need to hold that same amount of accountability to our leaders, to our elected officials, and to ourselves. So when we're talking about health disparities or crises or anything that disproportionately affects Black and Brown communities, I would like everyone to stand up and demand accountability from our governors and our presidents and our elected officials. We need to make sure that we're proactively looking out for each other. And when crisis hits, we're not caught blinded and we're thinking about these blind spots that we have in our society. So for instance, when we see data on over-policing in Black communities, lack of access to healthcare, lack of access to high-quality home loans to promote the American dream. This needs to incite anger, frankly. It makes the Black community angry.
Yeah.
It makes Black mothers angry who have sons who are going out into the world and they're fearful for their lives. That level of anger needs to be matched in all segments of society. We need to have the attitude that we're all a human family, just like the coronavirus has made us all human at a basic level. We need to recognize that a problem for one is a problem for all. And eventually the inequities that we allow to continue in society are going to come back to bite us in the end.
So sort of what I'm hearing you say is, instead of allowing this virus to sort of sow division between us, maybe focus on the ways that it brings us together.
Exactly.
Well, I think that's maybe a good way to end this segment to the podcast. Dr. Bell, this is a complex and important topic. I've learned a lot from producing this segment with you today. And I'm sure you've also given our listeners a lot to think about. Thank you for joining us today.
Thank you.